Established in 2002, Optum India is the global capability center of United Health Group, a Fortune 4 company committed to helping people live healthier lives and helping make the health system work better and efficiently for everyone. With over 2 decades of its presence in India, the team drives innovation by integrating healthcare operations capabilities and advanced data analytics and technology solutions to enable a simpler, more accessible and affordable health system. Hello and a very warm welcome to CNBC-TV18 Conversations. The person driving this transformation at Optum India is Uma Ratnam Krishnan, Managing Director at Optum India. In this role, she sets the company's vision across the country, helping teams deliver distinctive value across all businesses. Uma started her working life as a diplomat with the Indian Foreign Services. Prior to joining Optum, Uma served as the CEO and MD at Barclays Global Services. Over the last 3 decades, she has had leadership roles in NatWest in the UK, ANZ Grindlays Bank, HDFC Bank and Polaris Software. And she has served as an independent director on the boards of various companies and mentored promising startups to scale. Uma is a management graduate from the Indian Institute of Management and Bangalore, and she followed this up with Women in Leadership program at Harvard Business School and a strategy program at Wharton. And today I have the privilege of meeting her. Hello, Uma.
Hi.
So good to see you finally.
Lovely.
I've been reading about you, seeing your work, and of course saw the lovely office. And I'm so glad you're hosting us here.
Absolutely. Pleasure. Look forward to speaking.
Let's go check out the office. While we walk, we talk.
Okay.
You know, when I was looking at your portfolio, one of the things that stood out was such diverse experiences and very successful from day one. I mean, that's an interesting story about what happened at IFS that took you out from that world to the world of corporate, and then of course banking and now health. So let's start from the start. How did it all happen?
So I keep getting asked this quite often. Did you have a grand plan? Right? I genuinely didn't, but I did have a plan that whatever I do, I give it my best shot. So the IFS was a very good example of that. I think it's a good thing that I didn't know how hard it was because I tried it for the first time. But I think I grew up in an environment with kind of no barriers, no artificial barriers, no biases. For a long time, I didn't know the difference between what a girl could do, what a boy could do, which was great. So I gave it my best and I got through first attempt. And to me, it was a manifestation of, you know, if you give it and believe in it, your dreams can happen. Right. So that was my first sort of example of that, right? And then, of course, I wanted the IAS, but there were some rules that I got stuck with. I decided I did go through my IFS training, went to Missouri, and it's one of the most rich experiences of my life, and I cherish it a lot. And then, of course, I switched tracks, went to IIM, did an MBA, and then started a corporate career. Spent many years in banking and finance. And then, of course, decided to do something different.
I'm intrigued about your definition of success then.
So, I'll kind of encapsulate it in a couple of short phrases, and then maybe I'll just expand a little bit on that. One is make a difference, right? Be inspirational in an authentic way. What do I mean by that? Make a difference, impact on people you engage with, companies you engage with, make a difference, do something which stands out, and communities around you. So impact for me is really important. I think it's in the early phases of your career where you want to do bigger, larger jobs. And after that, it's what you do and how you impact people that becomes, for me, it's a measure of success. The second one, and this is, for me, a discovery and an insight, which is, it's lifelong learning. I like learning new stuff, right? It's about being curious about, and that's also why I've done a diverse career. I've done technology, banking and finance, and then now healthcare, right? So lifelong learning. Third, for me, success is the relationships I have built, you know, with the people that who've been part of my journey. They've been mentors, they've been cheerleaders, they've just been family who've supported me through this. So it's the strong relationships for me today after many decades of working. It's how effective and strong are these relationships, which I cherish. And the last one is I want many dimensions to my success. What does that mean? I like doing things just outside work, right? So it's about, you know, what floats my boat. I love the outdoors. I love hiking, I love wellness. Wonderful. So I find time to spend energy and time with friends and the passions I love.
You know, when you talk about service and passion, is that what essentially drew you to the healthcare sector? Also, the healthcare sector throughout the world is going through such a massive transformation. Take us through the transition from banking to health. Was that a seamless one? What sort of brought you to this industry, and what are some of the things that you're excited about at Optum?
Yeah, so I think what really drew me to Optum after many years of working in financial services was the mission of the company, which is helping people live healthier lives and making the healthcare system work better for everyone. Right. Now, in the COVID world, this became personal, this became real. Many of us experienced it in very different ways. So I think it's really the mission of saying, can I make a difference? And I go back to what I spoke about, which is I like to make a difference. Right. So that's actually one of the things that actually drew me here, right? And in Optum, that's kind of what we're doing. Sort of one insight, one connection, one person at a time. Optum is really a healthcare services innovation company, part of the United Health Group, which is a Fortune 4 company. And it delivers comprehensive healthcare across the board through 3 business units, which is the Optum Care, which is actual healthcare delivery and engagement, making patient experiences better. The second is Optum Insight, which actually helps, provides data, analytics, consulting, research across the healthcare ecosystem. Right. And the third would be Optum Rx, right? Optum Rx is a pharmacy benefits management and pharmacy care services business. So that's kind of Optum in a nutshell, which is our global business. What excites me, what are some of the changes that we're seeing, right? Healthcare is evolving, you know, it's complex, it's evolving quickly. It's particularly health tech is evolving, right? If I call out sort of 3 areas, and we're kind of in the middle of all of those. One is, healthcare is becoming much more personal and much more consumer-centric, right? So all of us research our condition now. We know which, you know, where to go, what's happening. We think we know what's happening to us, but all of it is available to us, right? So healthcare, where earlier it used to be somebody who's only the expert knows, we're starting to see that that's changing. And consumer centricity basically means you kind of have your information at the palm of your hands. You know which doctor you want to go to. You know you want appointments easily, quickly. Right. You want follow-up digitally, right? And of course, earlier on, people thought that only the younger generation would do this. But when people are starting to see outcomes, even this is really picking up. Absolutely. So this is a fundamental change that we're actually seeing.
What is this machine doing here?
So we spoke about health and wellness, right? So everywhere at our workplaces, you'll see trails marked on the floor, and this is a bike desk.
Oh, wow.
So if you find 15 minutes, you can put your laptop there, just get onto the bike, and off you go.
Oh, wow.
You can get
is it only in your office, or is it elsewhere around in the office as well, or is it your machine that comes here?
Yeah, I use it for if I've missed a workout, but you'll see a lot of these because we're genuinely very invested in wellness for our colleagues. So this is just one example.
Wow. All right. So we can take a break here and talk to you more about it with a cup of coffee. As you can realize that, you know, I'm not getting on that, but I will definitely have a cup of coffee. So let's go for that. And then we talk about some of the challenges that you see overall in the health industry and what does it mean to actually run a cutting edge organization that is trying to stay ahead of, you know, the technological times.
Sure.
So let's do that. Come. Welcome back. You're watching CNBC TV18 Conversations, where I am in conversation with Uma Ratnam Krishnan, Managing Director at Optum India. And before we went on the break, we were talking about your own interest in the healthcare industry, not just as a professional, but also as a person who keeps fit and pushes everybody else to also look at their health, which is kind of the sentiment everywhere. We are also looking at now people doing predictive health tests. Post-COVID, they are more careful about their health. What exactly is changing in a big way in the health industry, and how do you think Optum's way of working, which is with data and tech and also sustainable tech, how does all of that come together?
Yeah, so there's a lot to unpack there, and I'll try and, you know, sort of work through the story. I think healthcare fundamentally, you can say there are about 3 big challenges, right? And then we'll talk a little bit about what people are looking for, and then how does it get together. So the first one, and it's a triple aim. The challenges are, one is lower cost.
Yeah.
Cost of healthcare is going up. Particularly post-COVID, it's higher than inflation in most places, also particularly in the US. In some cases, there's good reasons for the cost to go up, right? There's new medication that's being discovered, new plans, new protocols. People with chronic conditions can live much longer. So those are all the good reasons. But on the other hand, there's bad reasons for cost to go up, which is a lot of money gets spent on administrative costs, for example. And if you go strictly for fee for services, right, you get a service, you pay, then, you know, the temptation is more services, more payment, right? So that's one big challenge, which is how do you get costs to be lower? The second one is access. And I think access is an important one because that will eventually integrate into how you actually provide care, how do you listen, and how do you respond to what people want. Today, access to good quality healthcare is not actually available in all parts, right? Remote parts not available sometimes. I think with COVID, we did a lot of progress in sort of telemedicine, consultation. But there's a lot more to be worked through in terms of privacy and safety and all of those things. Yeah, right? So there's a lot that needs to still happen. And then a third thing is really better outcomes. And this is fundamental, right? Which is your health outcome better? Now, how can we actually do this, right? What that really means is we want to make sure that there's enough support in terms of data, what's the next best action, what
precision
are the
treatments.
Yeah, what is the treatment, what's the next best action, which one do you actually need, you know? And sometimes you can standardize the care pathways, what should you be doing for certain things. But for that basically means we need to provide all of the supporting systems so that the clinician or the doctor can do what's most sacred in healthcare, which is listen with and interact with the patient.
True. I wanted to ask, as one of the leading GCCs in India, what are the key drivers of value creation, and what are the methods and means that perhaps you're using that can also be an example for others?
Sure. So as Optum India, we are a health innovation global capability center for the United Health Group. We work across the spectrum, which is across the healthcare ecosystem. Our objective is to create value in an integrated way: technology, quality, cost, innovation, right? Pulling all of this together. We have been in India now over 2 decades. And our ability to use healthcare domain knowledge, which is really important, operational expertise, and the technology and the data capability, pulling it together are some of the things that actually, you know, deliver what we need to deliver. And we're a very integral part of the global enterprise, right? Yeah, the GCC ecosystem, Global Capability Centers, is something that's grown exponentially over the last couple of decades. I mean, simply put, it started for cost arbitrage and then quickly scaled into delivery excellence at scale, right? So, and then moved into sort of global portfolios, global leadership roles, and then now is at a stage when it's come into an era of transformation, innovation, breakthroughs, and so on, which fundamentally drive business strategies for the companies globally.
A lot of thoughts to ponder over that you have given me through the conversation. My last question would be around the times that are coming. What message perhaps would you give to young healthcare workers or students who are looking at joining the industry? So yeah, a message for them, and what are some of the things that you're excited about in years to come in the healthcare industry, and why does then the healthcare industry become a very good place for young professionals to be in?
So yeah, so recently I met a young girl who, you know, many of them come and say, can I have conversations with you about career? I said, yeah, sure. And she just finished her master's in health management, hospital and health management. And she said, should I work in a hospital or should I work in a health services company, right? So for me, that was an aha moment for two reasons. One is the fact that people are slowly thinking about a career and opportunities in healthcare outside of a hospital setting.
Yeah.
Right? Because typically when you talk about healthcare, the only thing you think of is a hospital, right?
Yeah.
So I said, great, now let's see why and what. So I'll just translate a little bit of what I told her, right? One is, if you are somebody who's genuinely interested and passionate about patients and consumers, right? About what is important and are you making that difference to them, right? Then this is a great place to be in an industry where you can actually make a difference to individuals, to communities, and bringing to bear all of the good things you spoke about: technology, knowledge, clinical knowledge, AI, whatever you need to bring together. Because it is an industry that's going to be driven by technology quite a lot. But that doesn't take away what you said, which is at the heart of it is how can we actually help the person to live a healthier life, right? And that's, if that is a mission that resonates with the individuals, you should be actually absolutely looking at this. And it's not boring. It's going to be quite exciting,
yes,
right? Because the amount of change we're going to see in the way we're going to be responding to healthcare and the kind of advances that we're going to be seeing is going to be great. Of course, there are other decisions you'll have to make, which is, should I do it now? Should I do it later? Is it my only career? Is it, will I get more money if I go somewhere else?
Yeah.
All of those good things. My perspective there is that you don't have to do one thing forever, right? There are many.
I'm led by example.
Yeah, I'm a standing example. But there are opportunities in every area, and there are lots of things you can do even within healthcare as a domain. So you will have enough to keep you sort of engaged and interested and doing things,
and motivated.
and
yes,
you know, and a lot of learning, right? And the third thing I'd say, it's not a simple problem to solve. It's complex, right? Because there are many factors at play, and eventually it's a human emotion at play as well at the heart of it, right? So if you are really interested in impact, and I do hear many people saying, I want impact, right. Eventually you will be part of a larger community that makes the impact, right? And I still feel that the healthcare industry overall is on its path to a transformation, because some of the others have, that has happened. But healthcare is, I think, in the midst of going through it, and several opportunities. So if you're happy and up for complex problems, not easy ones, happy to use innovation, but knowing at the end of it, there's a real person you're making a difference to, this is probably a place and a sector where you can do your life's best work.
Fantastic. All I want to say at the moment is, can we retell our audience the Maya Angelou quote that you used?
Absolutely. Absolutely. So my mission in life is not merely to survive, but it's to thrive with some humor, with some passion, some compassion, and lots of style.
Wonderful. That's the perfect note to end this conversation. Thank you so much for this wonderful, insightful, candid conversation. Thank you so much, Uma.